Washington Governor Jay Inslee, a former member of Congress. Good afternoon to you.
Good afternoon.
Governor, we know that if there is a full repeal and replacement of Obamacare, it won't come in the exact form we saw in the House. But let's start there. How concerned are you for Washington residents with pre-existing conditions?
Well, we heard a congressman taking a lot of heat in a firehouse, and that's appropriate because people are outraged by what the Republican Congress has proposed to do here. And it is an outrage because I think people have figured out what is behind this. At its bottom fundamental aspect, what the Republicans have done here is not a health care bill. It is a wealth care bill. It is intended to protect the wealth of the top 1% of the millionaires and billionaires that they want to give a tax cut to. You have to ask yourself, why would anyone want to take away care from people with heart disease or cancer, or children for that matter? This is going to take health care away from over 20 million people, 600,000 to 700,000 people in my state. Now, what possible motivation would there be? And frankly, it's just to take the money out of health care for people who happen to have disabilities or are sick or the age 62 or 65, increase their premiums, reduce coverage with those with pre-existing conditions, and take that money and transfer it directly into the pockets of the ultra-wealthy in our country. Now, that is the scam that is going on here, and I think Americans are catching up to that, and that's why you have such outrage that's being expressed. Now, this bill can be killed. You might consider it dead already, considering its fate in the Senate, but we need to be very vocal on this. People need to be in those firehouses. They need to pull the fire alarm. This really is a travesty, and I think people are understanding that.
Well, speaking of, putting out a message, only one of 4 Republican representatives from your state voted for the bill. That was the McMorris Rogers. What message do you have for her and her district?
Well, that this is going to hurt our state. I think it's very unfortunate that this member did not listen to the people of her state. She did not listen to the insurance commissioner who advised her, and I actually sent a letter to her with our insurance commissioner advising her that we had looked at the proposal in detail, and here's what we concluded. There'd be about 700,000 people, and this is incredible, who will lose insurance. They will not be insured as a result of this plan. We have already had 20,000 people who have had treatment for cancer as a result of the existing law. And this is very personal to me. You know, we talk about numbers, but when you look at people whose lives have been saved because of the existence of health insurance, it is deeply angering to me. I met a person in Spokane, which is the district where this congresswoman was from. She was a small business person. She's struggling business, never being able to have insurance, was finally able to get insurance because of the health care reform bill. Then she found a lump in her breast. She was able to get diagnosis and treatment for that. Now she's a cancer survivor. And what she told me when we went and met with her was, you know, maybe there's ways to improve this bill. It's certainly not perfect. But I'd be dead without Obamacare. And we had to keep the fundamental coverage for these people. Now, to take this woman and tell her and 699,000 of her fellow Washingtonians, you're going to kick them off insurance, that's an abomination. It is a moral outrage, and it will not stand. That's why I don't believe this bill will pass. It's why Americans across the country are going to be flooding their senators now with messages that this is certainly unacceptable. And by the way, the people who are hurt here, let's talk about who they are. Everybody who's listening to this today has a loved one who has some serious problem, cancer, heart disease, emphysema. These are working people. These are children. These are 62-year-old people who can't wait to get on Medicare, who will no longer be able to afford coverage because they have a pre-existing condition. And talk about the scam here for the Republicans to say, oh, you're going to get coverage for pre-existing conditions. Sure, if we can charge you another $100,000. There was a evaluation done of this that said under this proposal, if you had some stage of malignancy or heart disease, maybe you could get insurance, but you have to pay another $25,000. People cannot do that, working people in our country. So we need to keep this country moving forward, not going backwards. People need to get up on their hind legs and speak in the upcoming days and weeks. And if we do this, we will defeat this obnoxious effort to take away health care for Americans. I believe that's possible, and I'm committed to it. We've had great success in our state. We've cut our insurance rate more than half. We've reduced the rate of medical inflation by 2/3 because we've done this right. And other states should do the same and follow Washington State.
I don't have a lot of time left, but I want to squeeze this in. I'm wondering if you could explain this without getting too much in the weeds here. The Medicaid expansion has been such a big topic for both Democratic and Republican governors. Some of the GOP senators are former governors who understand what expansion has meant to the states. Do you think they'll extend the House's timeline to phase out the expansion?
Well, they should not allow the elimination at any date of this expansion. By the way, this is a bipartisan outrage because both Republicans and Democrats get sick. And both Republicans and Democrats have children. And to eliminate coverage for 20 million people who have benefited because of this, 600,000 in my state, people need to understand how grievous this is. What this proposal would do would be to eliminate coverage for 6,000 people in my state, most of whom are actually the working people in my state. Actually eliminate it, not simply reduce it, or phase it out or sand it, eliminate it. That's why Republican governors are so angry and upset, as well as us, who have been successful in expanding Medicaid expansion, and including children. Look, they're cutting this that's going to reduce coverage for children in my state. This does not stand for me, and we're going to fight it tooth and tongue, and I do believe we can win this battle. I encourage everyone who shares my viewpoint on this to get active on this. Those people in that firehouse, they're going to win this battle when we get this message to senators, I believe, because this is unconscionable.
I have to leave it there. I feel your passion. I'm just coming through the screen. Governor Jay Inslee, thank you for your time on this Saturday.